How many times have you gotten back from a good mountain biking trail? Perhaps you're out playing golf and your elbow really hurts you. It very likely could be tendonitis, and for that we turn to Dr. Jeremy Bruce with Erlanger Sports Medicine. So this is a real problem. Kind of no matter what your sport, your elbows are going to be involved with it, and it can be debilitating.
It very much can be. We see a lot of tendonitis problems around the elbow. It can be everything from the outdoor activities that we're talking about here with mountain biking, rock climbing, but it can be anyone just going into office carrying a briefcase, or just someone who does a lot of work with their hands daily.
Folks who are on Rock Creek's website very likely are trying or already are avid rock climbers. There's so much of that in Chattanooga. But you cannot do your sport if your elbow is a problem.
That is correct. So we use the generic term, we use tennis elbow when it's on the outside, golfer's elbow when it's on the inside. But we see them interchangeable with sports. We see them actually both involved with mountain biking and rock climbing, especially rock climbing, where you're doing a lot of gripping and grasping techniques and really firing those muscles around the elbow. And what it is an overuse injury where that tendon just gets a little overworn and irritated.
But here's the great thing, as with so many problems that you suffer, early intervention is your key. But in this case, early intervention can really change things pretty dramatically with some techniques that you use.
Absolutely. So catching this early and getting this settled down early is the key. Very, very often we can treat these without surgery. It's extremely rare that you need surgery for these, but you do have to be diligent and catch them early and shut them down as far as rest and ice, usually some physical therapy, and even trying some anti-inflammatory creams or oral anti-inflammatory medicine.
Okay, let's touch on the anti-inflammatory creams for a minute, because what you may get at the store is different from what you're going to get at your office.
Correct. So the prescription strength anti-inflammatory medicine are very similar to the oral medicines you take as well, but they absorb through the skin to work on the area there.
You were telling me too that when it comes to early intervention that you use a technique called dry needling and something else that's changing things dramatically for people.
Correct. So if we got to a point, say 3-4 months that's been going on and we're just not making headway with these non-invasive techniques, then we do have techniques short of surgery still. There's something called dry needling that some of the physical therapists and we also do, where you're going in with a needle and just trying to stimulate some blood flow, trying to stimulate a healing process. There's also something called PRP injection, where we're actually taking the blood, spinning it down, pulling off the growth factors that have a lot of healing potential and re-injecting those back in to try to help the healing process.
If you haven't done that early intervention and perhaps that overuse is just too much, is a surgery going to prevent you from getting back out rock climbing?
No, it should not. Surgery is always our last option. Okay, surgery is saved for the athlete who's just been struggling for 6 months to a year and just not making headway. Again, this is our last ditch effort. But with surgery, we have a very good option of going in, debriding some of that tissue that is problematic and getting that to heal up so you can still get back to your sport.